phone there.
Yeah, you're right. I tried to tell her,
Uh-huh.
but you know, it's trying to turn the. Go ahead, I'm listening.
Okay, good morning, everyone. Welcome to the Monday morning Board of Supervisor meeting. I'm Chairman Darren Hamilton. I'm going to call this meeting to order. First business on our agenda is acknowledge the minutes from the previous meeting.
Second.
I have a motion from Dimmitt, a second from Sandquist to approve the minutes. All those in favor say aye.
Aye.
Aye. All those opposed, same sign. Motion carries. Okay, we'll move on to Chris Estel with a public health update. Chris?
Hey, how are you guys? I'm assuming you can hear me okay.
Yes.
I don't know why that's stuck right there in the middle of my, there we go. I'll move it over here. Okay. So good morning. I just wanted to give you guys a quick update. I just was on the coronavirus.iowa.gov website. We have 71 cases to date in Jefferson County. We've had no deaths from COVID-19, thank goodness.
Chris?
Yeah.
Knowing that we have 71 cases, that's from the start through today. How many active cases are there?
Well, the state has changed how we're doing follow-up. So after 28 days of their initial diagnosis, then they're considered recovered. So I'd have to go back and look because I don't get hung up on that. Darren, I really don't.
Well, there's a lot of people that ask those questions, and so that was why I was asking it.
Yeah, they can go to the website and find that information. Like I said, I don't get too hung up on the numbers because numbers are just that, numbers, and sometimes it's not an actual reflection of how somebody is actually feeling or doing. Because we still do follow-ups on people, even if they're, quote, considered recovered. But if they are still having problems or questions, they're going to continue to call the health department for guidance or, to answer medical questions. So that's why sometimes I don't get hung up on that, because we just had a phone call this morning already from someone that was considered recovered, but they had questions. So does that make sense?
Yeah.
Yeah, okay.
Mr. Dimmitt says no, it doesn't make sense to him.
Just because they called and had questions, what does that mean?
That means they're still having symptoms or they're experiencing issues or they want to know more information about their family. This is no different than any other communicable disease we do follow-ups on.
Thank you.
This is
right.
This is the same process.
As of this morning, the Department of Public Health's website said we had 52 recovered, notwithstanding what you just stated. What I also want to know is on the 71 that we have listed as total from the beginning, in a situation, and I know this for absolute fact, we had an individual who tested positive. She was going in for surgery, and they tested her as a protocol. And so they put the surgery off. Husband wanted to get tested, and they told him no. They just considered him positive because his wife had it. Does that count in those 71?
No. The only thing that we do are the lab confirmed cases, as with every other communicable disease. So you could have 5 or 10 people living in your household. You can all be symptomatic, and they're only going to test one person in that household. So that's why I say I don't get too hung up on numbers, because it's not a true actual reflection of what's really going on. Same thing with pertussis, which is whooping cough. If you have a whole classroom of kids that are symptomatic because there's been 3 or 4 confirmed cases, the providers aren't even going to test the rest of those kids that go to the doctor's office. They're just going to prophylax them with whatever appropriate antibiotic they can have if they're not allergic to it. And so those numbers, those case count numbers, are not brought into the actual case, so the case total. So this is why I don't get hung up on numbers, because we've actually done more follow-ups than what it says anyway, because there's been an address question or a address issue. Does that make sense?
Yeah.
So,
in this particular instance, these 2 individuals, neither one ever showed any symptoms, never ran a fever, and were never sick. So I question sometimes the accuracy of the test.
Well, there is that too. There's still a question about the sensitivity of the test. And, you know, we know that there's a large group of individuals in the population that, the same way with MRSA, methicillin resistant staph, you're still going to be a carrier, but you might not have any symptoms. That's why they do a nasal swab a lot of times before you have surgery to see if you're a carrier, because we need to treat you as you're positive, but in the rest of the time you aren't even going to know that you're positive. So, but that creates a problem for us with follow-ups. This is how easily it's spread. And again, it goes back to your own health. If you've got an underlying health issue, an autoimmune illness, you're undergoing chemotherapy, you're diabetic, all of those things make it more challenging to fight infection, whether it's this or anything else. So I know it just becomes a dog chasing its tail with numbers, and you can make numbers look however you want to make them look. So I know how many follow-ups we have done at the health department. So
Thank you.
yes, you're welcome. You have
Chris, can
Yes.
I ask our audience to put themselves on mute? Somebody's been typing and scrolling, and that's all we're hearing. So, okay, thank you.
So yeah, so we've been Brett Farrell and Stacy, and I know Brett's on. Okay, Brett Farrell. I know that we've been working, continuing to do what we need to do with our community partners, reaching out to them, having webinars, Zoom meetings. We continue at the health department to participate in weekly Zoom meetings with the Iowa Department of Public Health for the latest updates. There's been a lot of changes at the state health department. The director resigned, retired. We had a Zoom meeting last Friday with Kelly Garcia, who is the director of Department of Health and Human Services. She's been appointed the interim director for the Iowa Department of Public Health. And we let her know our concerns and our frustrations at the local level. And we know as healthcare professionals, you're going to see things change and guidance change. But at the same time, it doesn't need to change 3 or 4 times in a day. And when the state says they're going to have a Zoom meeting, they need to have the meeting and not cancel it. So we're struggling to get direction from the Iowa Department of Public Health. And most of my elected officials know that. So at the state level. So we've been very fortunate. Our nursing homes have done, and assisted livings have done a great job with mitigation. We've been, knock on wood, I don't even want to say it, but I will. They've done a great job. We've not had an outbreak at a nursing home, and kudos to them and their staff for implementing the procedures that they need to follow. We're trying to get things, quote, back, not to normal, but we're trying to offer services again. Our immunization clinics are back up and going. It's a little different because we have appointments now versus just walk in, to decrease the amount of foot traffic. And actually people like having an appointment because nobody's got time to sit and wait around on something. So the appointments are working well. We've started our home care services again. Of course, our staff wears, you know, masks and shoe covers and eye protection. We asked the patients if they wanted service, so they all feel comfortable. We had 2 people that didn't want to start service at this time just because of their own health concerns. I don't know. What do you guys, it's been a long time since January, I'm not gonna lie. Our schools, I've had a lot of contact with Dr. Knoll and with Dr. Bell from MSAE. We've had some contact with Dave Harper from Pekin, but most of the questions have come from MSAE and from the Fairfield Community School District. You know, everybody had to have their return to learn plans submitted by, I'm looking at the calendar, by July 1, and then the governor changed that. The schools didn't have any heads up on that announcement a couple weeks ago, so now they're scrambling again. So it's just tough times. It's tough times for everybody. And as parents and grandparents are concerned, and the only way we build antibodies though is by exposure. So we have to be exposed at some point, and our bodies have to hopefully do what they should do when we are exposed to viruses. So questions, comments? Brett Farrell, what do you have? Am I going to look at your black screen, or are you going to come, are you going to like, are we going to get to see you? I hate that when you're having a Zoom meeting and everybody's got their screen black. I want to have mine black too, but you know, do
You're
you guys
black screen.
have?
It was going to be on if we had questions. Anyway, we thank you for the update because we hadn't had one for a while.
Yeah, I'm gonna have a safety meeting next week. Let me look at my planner. I think it's next. Is that next?
Wednesday.
Next Wednesday. And I plan to, hey, there's Brett Farrell. I plan to do it via Zoom. I think it'll probably be easier for everybody. You know, we still see numbers in the community. We still are dealing with stuff. So I'll get that agenda and the Zoom link sent out this week. But Lee, does anybody have any questions or?
I have it's probably not in your wheelhouse.
Okay.
You mentioned the nursing homes. I have a concern. I have a mother-in-law in a nursing home, and I have a concern about their psychological state, not having seen family members and not having communication. And is there anything being done for that? I mean, that could be as devastating as anything else.
I agree with you, Lee. I do. And I know that that's a concern. And I know that our nursing home partners feel the same way. But they are mandated by the Department of Inspections and Appeal, their governing entity, when you receive Medicare and Medicaid funding. So they have a pretty strict set of protocols as far as when they can allow visitors and when they can start that. And then if they have to go backwards and not allow visitors. I know most of the places are offering like Zoom meetings or excuse me, FaceTime. It's not the same. I understand it. I totally understand. I have a sister that has special needs that lives in a group home. I totally understand what you're saying. And I think that's the push too with school. We're seeing kids that need other support other than just, you know, disease mitigation, you know, their mental health, their access to nutritious meals. So I would encourage you to talk to whoever the director of nurses is or the administrator, Lee, and make sure that he or she knows your concerns. I do know that Sarah and Roberta and Josh have all said that in meetings.
Okay, thank you.
Brett,
Yeah, you're welcome. Yes.
is the community doing okay on PPE, the healthcare providers and everybody?
Yeah, we're actually doing good. I was just looking up on my numbers across the state, but we haven't seen an issue in our region or across the state so much for PPE. We got another shipment in last week for some things, gowns and stuff. And I just did a current inventory over at the hospital, what we got available, and we're doing good. And part of that reason is, you know, everybody's been told to order from their suppliers, including nursing homes and everybody else, and keep the stuff that we have for the hospital. So I was just trying to look at some numbers to kind of give everybody an idea, and this can be found on the coronavirus website. And I don't pay attention so much, like Chris said, to the numbers, because that's kind of her gig and what we're doing. My concern is hospitals and where we're at on, you know, if we have to put our plans into place to move people around. And you know, currently, state of Iowa, not too many people mention that, but we're doing, I think today for the whole state, you had 241 people that were hospitalized for COVID and 78 of those in the ICU. And, you know, they give you all kinds of numbers, and that's what I focus on when I look at the numbers on a daily basis, where we're sitting at as far as overwhelming hospitals in our healthcare system. And, you know, we have, in the state of Iowa, you have well over 50% of bed availability, ICU beds available. And even in our region, you know, right now in our region, which is Region 5, we have 53 people in the hospital, 26 of those are ICU beds, and there's 544 beds available. So, you know, the state's doing really well as far as capacity for hospitals. And that's what I focus on.
Thank you.
And I do want to just say, you know, I know most hospitals now are, you know, up and going with their elective surgeries, elective procedures, you know, joint replacements, colonoscopies, et cetera, whatever the case may be. But of course, here it is just the end of July. So, and we know with respiratory illness season, you know, coming up, we just don't know what it's going to look like. And it's not just the coronavirus. It's influenza. It's other people with other underlying lung issues that could need a hospital bed. So those are some things that we think about. I know last week Brett and Stacy and I met, and we're trying to still think 4 steps ahead of where we're currently at. So that's why sometimes I don't get, I try not to watch the national news because it just makes me crazy, or than I already am. But we have to look past where we're currently at and try to guesstimate what we might need and what our impact might look like locally. So, and that's a hard thing to do. So I do know we asked Stacy to be on, but who is Mike, by the way? I don't know who Mike is, sorry.
Mike Brown.
Oh, okay. I'm just talking to a name on a black screen, so that's okay. I know Stacy said that the hospital's looking to get more testing supplies because there's only so many kits available. And I do know that, there he is, hi. I do know that at some point they want to get point of, what you might want to consider point of care testing, but for the news media, I would encourage you to reach out and talk to Brian Hunger and not use me as a source for this information, just because but I'm just giving you guys a heads up. They're moving forward. They're looking at things differently and they're trying to ramp it up. But Lee, back to your original statement, if you got one confirmed case in the household, you're probably not going to see them test everybody in the household if they're symptomatic. So.
Okay, well, thank you, Chris.
Yeah, if you guys know how to find me, if you need something else, I'm going to stay on for a little bit. So I'm just going to mute myself and black my screen out. So.
Thanks,
Sure.
Brett.
Thank you, Brett, as well.
Thanks, Brett.
You're welcome.
Okay, we'll move on to meet with our county engineer, Scott Klein. Good morning, Scott.
Good morning. We've done our normal blading on gravel roads, brush cutting with the boom mower, and there's been some culverts that were replaced, repaired in District 6, and a repaired culvert on Glasgow Road. There's been some edge rutting repair. It's actually on some of the newer resurfaced roads. There's different mailbox configurations, and the shoulders are put in pretty essentially uniform. So some of those they've been just spreading the gravel out a little bit better, so that when mail carriers pull into the mailbox, they're not dropping off or whatever. Let's see. We have a rubber tired roller. I mean, it's a really old piece of equipment that you pull behind, and in the shop, they replaced the tires and the rims on it. So now it's more usable. And let's see, mowing, they're doing ditches now as well as the shoulders, since it's after July 15th, and that's by law when you can start mowing the ditches. Certain people have mow out in front of their house and things like that, and those are exceptions on the law, so they can do that. On Pleasant Plain Road, and I think this is asked about maybe one of the last meetings, but there's a place between the asphalt sections. It's part that's still concrete, and they were doing some work on that to patch that.
Yep, that was all finished last week.
Yeah.
It's great.
Oh, good.
It really is. It's really good.
It was on my last week's accomplishments, and I brought it up to this one. I'm giving accomplishments over the last 2 weeks. So there's been rock hauling on spots in the county, spot locations. Been shoulder maintenance. And with that upgraded roller, they used it out on Juniper between 260th and 270th, that mile stretch that was regraded, and they used water during the rolling process and some calcium chloride to try to get that onto their surface.
Sorry, she was just asking a little question about who someone was that was on.
Yeah.
I had a call last week, and I've referred Don to Lee because it was a nuisance issue, more or less. But along with that, I also had some questions about people that fence off their ditch in front of their property in order to use it for grazing for animals. Now, that's something that the county does not allow, correct? The right-of-way ditch bottom?
It's considered an obstruction, and there is a law against obstructions.
So do you send letters out? Because when we did that road tour, we saw that one down by Four Corners.
Yeah, well, we've been rather busy, but we do need to send letters out.
Yeah, because I was just by there the other day and it's still.
Yeah, unless I'm paying attention.
Yeah. That wasn't the particular location that I was talking about, but
there's another one on
along
136th.
Okay. Along with that, there was a question raised about baling the grass and brush in your ditch bottom. How long are bales supposed to stay out there? When is it that people can start baling ditch bottoms? Because I've seen some of that going along on state routes already, so I know that they're allowing it there.
Do we have that in the county?
We don't have a lot of extra wide right of way like the state does, and the state.
Right.
There's times when the governor, because of drought conditions or whatever, will proclaim that you can do the hay baling in the ditches, which otherwise it's not supposed to be allowed. But the state may have some arrangement with different people, some kind of lease or something like that. And I'm not totally familiar with Iowa on that, but I know, for instance, that the Missouri DOT leases ground to people to do hay baling.
Yeah, I'm not sure how that all works either through the DOT, but I do know that they allow that at times, like you said.
Yes.
It allows that. But is there anyone else that wants to make a comment on that? Was somebody? Okay. Mike?
Yeah, let's see if he can get a hold of Trish in the next 2 weeks, and I don't know what else we can do.
Mike, could you put your computer on mute? Mike Brown.
Sorry.
Thank you. Anyway, that was another concern that came up in the conversation. And I was thinking that some of the areas that we have a wide enough right of way in order to do that in are along our paved roadways, and we don't want big bales of brown bales sitting out in ditch bottoms. If they do bale it, they need to get the bales out of the ditches as soon as possible or convenient.
Well, I agree, because it's an obstruction, and the obstruction law also says that people are not supposed to be planting crops in the ditch.
Right. That also
on the county right of way.
That also causes drainage issues where you're going over the crown on the back slope and down into the ditch. It creates more runoff into the ditch that, isn't necessarily what farmers want. They don't want their stuff running off into the ditch, but it does when you're farmed that far out, too close. So those are a couple of things I wanted to bring up while we were talking about the road conditions and different things going on, because this is the time of year that we start seeing a lot of this happen. So,
Right, and people that plant, say, corn out into the right of way, I noticed on Gear in the city, I've seen a lot more deer traffic because of the corn, and they can stay in there all day long, whereas with soybeans, you wouldn't see them at all. So just about every time I go up Gear now, I see deer coming out of the corn or going into the corn, or standing there on the road waiting until I get close enough that they can jump out in front.
yeah,
So
yeah, they're good at that.
I have had to stand on the brakes to keep from hitting a couple of deer here the last week or so.
Okay, do we have any other questions for Scott?
Well, first off, comment, I got, just want to pass on a kudos for the job that the crews did on dust proofing up Brookville Way, or up at Abington Way.
Okay.
Very appreciative of that. They said they did a really good job, so I just wanted to pass that on. And so, since you're our subdivision guru, and we have attorneys on as well, I have a question. This particular situation is occurring at Sofair Farms, but it's not unique in the county. I had a call from a septic tank supplier over the weekend, and there's one of these little houses being built out there on Sofair Farms. And that's fine. I don't have a problem with that. But in regards to, there's quite a number of houses. I was on the phone with Steve at the assessor's office, and that's being assessed as each one of those property owners that has those little houses or built a house, that's being assessed. I don't know how else to describe it except it's a co-op, and then the assessed value of the land is divided proportionately amongst the people that have the little houses there. So they're paying property taxes on this ground. They don't officially own it per se in terms of subdivision. But so I have two questions, attorneys. One, are we being hoodwinked, so to speak, by a backdoor method? And secondly, does our 1 acre requirement that's in our subdivision still apply when it comes to installing septic systems in a lot of areas? Because we've got a situation here where we in effect are subdividing, but and I believe it meets the definition of subdividing, but it doesn't meet the definition of subdividing.
Well, does each tiny house have their own septic
Yes.
tank?
Yes, and this one, this one that's going up, it's according to, I've not been out and looked at it, but it's a relatively small lot because it's a very small house that's being built. And yes, and so they're putting in, if I recall correctly, Jim said a 220-foot sand filter. Now I don't even remember. Do you remember how many acres is out there? Sofair Farms.
No, there's different sizes of lots. But supposedly there's only 4 ownerships in the subdivision, because if there was more, then that would be exceeding the number of lots is available. And if people say, well, officially I'm going to sell you this, but you can't tell anybody I'm selling you, or things like that, then that could be some way of getting around the sizes of lots. And but supposedly just 4 ownerships would be allowed.
Well, you can have 4 ownerships. You can own some. She can, I can, and he can. And then I can put 15 little houses on it.
Now, we don't have anything that I know of that says.
That's my point.
Correct, and that's some conversations that have been held at various ISAC meetings that I've been at, and that falls under the issue of zoning. And I think that we're going to see more and more of this type of development going on in this type of situation. And I would think that it's going to cause more and more problems with the assessor coming up in the future, but I can be corrected by Our attorneys, either Pat or Mike, if you have any comments on this, we would
And
appreciate
to
it.
your point that you just made, Steve asked, when does it become a trailer court? Or something of that nature, if it's buildings on leased land, how many, so that we start assessing it as commercial as opposed to.
Right, are they a permanent structure or are they a mobile structure?
And my question would be to the attorneys, even in regards to zoning. We are requiring in our subdivision ordinance, if you're building a home, we don't particularly care the size of the home, but if you're building a home, we've determined that because of, I realize septic systems are changed, but at the time that subdivision ordinance was created, we said 1 acre with, you had to have a minimum of 1 acre unless we granted a variance. That was for one home. Now, if I've got 2 or 3 homes on this 1 acre.
Well, if they're tiny homes with 1 bedroom, then 3 of them would be like a 3-bedroom.
But the subdivision ordinance doesn't make that distinction.
It
The only
doesn't.
thing that applies in that regard for the size of the house is what is the size, the minimum septic tank is 1,250. But this number of bedrooms will regulate the size, square footage of your sand filter, if that's the system that you're using. My point is, our subdivision ordinance doesn't have any description of that whatsoever. It just says that you have to have a minimum of 1 acre unless this board grants you a variance.
Mm-hmm.
That actually is a subdivision, is it not?
It's a minor subdivision.
Okay.
And like I said, there would have been 4, I know that, I would think there would be 4 lots out there without even having to look, because there was some discussion from the main person that started all that about having an additional lot. And
Yes,
I
I
said,
remember
well, can't be under, you're gonna have to develop it as a full subdivision.
Yeah.
If you go with 1 more lot.
Yeah, my concern is this, being equal or applying the law or the ordinance equally. How can I require you to have a minimum of 1 acre and you're building 1 house when I've got 1 acre and they're building 4 houses, albeit they're small houses, but that's not the point.
And I don't know from Dan, what.
Yes, but see, Dan wouldn't control our subdivision ordinance. He would just control the size of the septic system. The question is, and the attorneys can jump in here. My question is, can we, should we enforce the subdivision ordinance? Even, and in this case, it is a subdivision, but even if it's buildings on leased land, and we got a situation in Henry County right now with an attorney that owns the land that you guys may
I've been dealing with you.
where they put cabins on leased land. This is definitely a building on leased land, and they built cabins.
Okay.
Which was a violation of code. Now there's a big argument between the attorneys and the county sanitarian and the property owners as to who's legally responsible to pay for those septic systems. I don't want to get into that here.
The other thing I see in this is if somebody buys a 1 acre lot in an already established subdivision as a co-op between 4 people to build 4 tiny homes on this particular lot, we have no zoning restrictions for something like that, as well as no coverage from our subdivision ordinance, as far as I see it. Now, are we talking about something that needs to be addressed here, Mike or Pat?
I haven't looked at that ordinance since I've come back, so I'm not exact. I mean, I was there when it was originally enacted back, 25, 30 years ago. But some of that isn't that dictated by the amount of ground that you have to put your septic tank in anyway?
Yes.
That's what it was based on initially, I would think.
It used to be that the minimum size of a sand filter was 720 square feet. And so to allow proper drainage or discharge and
Right.
what do you want to call it, how you put the house.
Setbacks.
And all that other happy stuff. And I understand what Darren said about, we don't have zoning zoning where you put 4 little houses on there. But now, like for example, up in Lindy, our sewer system that's up there, we have 4 homes on one system.
Mhm.
I'm not saying that that can't be done. My question is whether our 1 acre minimum is, our 1 acre minimum is required, and at the very least, then they have to come to us to grant a variance so that we know what the heck is going on. Because this could get out of hand very quickly.
Yes.
Right.
Here's another situation. I've had at least a couple of people talk about that they want to, or wanted to, and I don't know that they've done it, but get a 1 acre piece of ground and put like 4 apartments on it, or a couple of duplexes or something like that. Well, they own it, so I don't have any control through the ordinance to say that they cannot do that.
Okay, let's let our attorneys chime in here.
I'll tell you, I could take a look at it. I just don't know right off the top of my head what that answer would be. I could report back next week.
Well, at this point, I think we're contemplating not having a meeting next Monday. So it would be 2 weeks that you'd have to go through that and come back with a small report for us. Okay, Mike?
I'll do that.
Okay.
So Mike, since you've got 2 weeks, does that mean that it'll be the perfect answer?
Of course.
Okay.
Okay.
FYI, ICAP is having some free zoning webinars, and I've signed up for them just to see what I can learn.
Yeah.
One is this Wednesday, and then they're, I don't know, through the fall.
Okay.
But it's through ICAP.
Zoning and planning.
Yeah.
Mhm.
ICAP. They're paying for it. It's an ISU extension.
Hey, Shane, right, Chambers, Jefferson County.
Finds it's valuable, so they're paying.
Good, good.
County.
Hey, Oliver Goon, social security number.
Okay.
Somebody needs to meet.
So, yeah, that would be, nope. Yeah. Anyway, we'll move on. We have review budget amendment request with Sean Morrissey. Sean, could you slide up just a little closer?
No, it's been very slow.
And then we'll get started with this.
Yeah.
And explain the nature of
We
the
had a district meeting.
change.
Was it
Yeah,
Thursday. And
real briefly, last fall, we applied for a grant,
even the assistant side of it.
habitat money, to build a pond at Zone
Yeah,
3
that's
Hill,
amazing.
Bigger Pond, and this money comes from fishing license sales. It's state money that conservation boards are available to apply.
Put yourself on mute. Okay.
After the budget process,
Upper right
March,
corner, there should be a little blue or 3 dots.
then that we, we're gonna get, basically, it's a 90% cost share of the pond construction.
that's
And this
great.
was a $60,000 roughly estimated clearing and construction, all, the whole project is actually $64,000 estimate. So, and I had talked to Shannon in the auditor's office about how we're gonna handle this, because basically we have to pay the bills and then we get reimbursed once it's all complete. And she said, well, we'll figure that out when the time comes. Well, our contractors moved in about 2 weeks ago. So I said, okay, I gotta start paying bills pretty soon. And then she kind of figured out how to go about doing this. And we have a REAP account, which is another state funded program for conservation projects that we get about $10,000 annually. Jefferson County Conservation Board does, and we have that banked through the auditor, and it's over $60,000. So we came up with it. Well, we'll pay it out of that, and then when we get reimbursed, we'll put it back in. Pretty simple. But I had only in my budget estimated $20,000 expenditures out of that account. So she said, well, we're gonna have to do an amendment.
So
She thought we would have to do it now, but she did some more digging. Well, after I got on the agenda here, that she thinks we can spend it out of the account because there's some other big money projects in related accounts, road projects and things like $6 million, I think she said, or something, but, and then just it'd be easier for them to do it at the end of the fiscal year when she does the other amendments.
Your timing is great because it's the beginning of the fiscal year.
Yeah.
So.
Well, yeah. So basically, it's how the auditor wants to do it.
Right.
It's not additional county money.
Right, it's spending authorities.
It's just spending money we have and then getting reimbursed for it through the auditor's processes.
So then we need to table this?
I think she just wanted me to come in and make you aware of what was happening and what would be coming
Makes
next
sense.
spring. And
So that's more of an informational thing,
Right.
so we don't need
Have
to
to
have any action on it, such as tabling or anything like that.
How's everything else going?
No,
Good.
it's fine.
we're pretty busy, even in the coronavirus situation. Our campground's been busy, and there's a few things that are going to be off, but generally the parks are very popular. I think more so than in a normal year. We've had a lot of new visitors, and they say all the camping, fishing, biking, all these things are what people want to do right now. So, and it's the middle of summer, so we're always busy then anyway. So, no, things are going good.
Okay.
Thanks.
All right. Thank you very much, Sean. We'll move on to set a date and time for a budget amendment hearing.
That would be
For that.
For that.
So we don't need that.
Okay, so we won't need that. We'll move on then to discuss and consider pay raise for Mary Porin, Jefferson County Conservation. What does Mary do? And I see that she's, let's see, right here. Mary Porin would be moving to $10 an hour.
Yeah, I can just explain their situation. Mary and John Foran are what we call like our campground hosts at Macoun Access. They live just south of Macoun Access, a few miles. I've been doing that for a few years, and they basically get a monthly stipend when the campgrounds are open, like April through October-ish. And I am kind of new at this stuff, but I noticed that Dennis had been giving them a $10 increase annually. So they're going to go from $330 a month to $340. It's not a big thing. And here again, this was something that you have to approve, and that's why.
So that would be $165 a payday to $170 per payday, which means $340 per month for just the summer months. Is that?
Yeah, April through October is when they actually go down and collect fees. And John Corn actually has been mowing that through a contract for us as well. So they're very interested in the area, and they save us from having to go down there multiple times throughout the week. And
John's been doing it for a lot of years.
Yeah, so it works out good for us and hopefully for them.
Okay, I would make a motion that we go ahead and approve this change of $10 extra per month.
Second.
Okay, I have a motion and a second. All those in favor say aye.
Aye.
Aye. All those opposed, same sign. Motion carries. All right, we'll move on to make committee reports. I did not have any committees that met this last week, so I don't have any reports.
Rather eventful week, I guess you'd say. The normal meetings were SERG and 1015 Transit and Area 15 Regional Planning. Nothing for SERG, earth-shattering for SERG or Area 15. Things are looking good. Our budget is good. We have quite a few projects in the works, administrative projects in the works that Area 15 is doing for surrounding communities and counties. SERG added Avenues County to its to our conglomerate, if you will. So Mark Waite was there for the first time. And then also Lucas County. Dennis Smith was there for the first time, which is good. It generates more revenue. And those counties determined that they needed hazmat. So that was probably the big thing as far as the CERT meeting goes. 10:15 transit. We've got all our drivers called back. Ridership is moving back up, which is a good thing. Fixed routes are going well. There is some question whether or not the city of Ottumwa is going to be able to jettison their levy for this fiscal year that they levied for fixed routes, since the budget was already certified. That's still in discussion between the state and the city of Ottumwa. If it turns out that they cannot, that money will come to 10:15 transit. I talked to Jay. What I think we'll do is make an effort to put the money back in the pockets of the residents of the city of Ottumwa by offering free rides until those dollars are exhausted, so to speak. We don't need it in our bank account, I think that, I don't know exactly how that will look, but I think it's the right thing to do to give it back to them. That being said, we've doing some more advertising, new logos, so it's going well. Ambulance, we purchased 2 ambulances this week from Lifeline, and one's a brand new rig, a 2020 F450 with a 2009 Lifeline refurbished box. They brought them down for us to see. The other one is a used 2016 F550 with a refurbished Lifeline box. And Bob Keller came from Bob's Automotive and crawled in and underneath and around and in and out and drove the used ambulance. Was very impressed with it. Had about 4,000 hours on it. Had 125,000 miles, but primarily transfer miles, which for a diesel, that's not a lot of miles. And if you figure that spread over 4 years, it's pretty light duty work. Mm-hmm. And again, Bob, like myself, was concerned about the hours, but the hours were minimal. So the truck didn't just sit and run. That was $55,000. That includes the striker cot and lift where they go in and it just lifts itself. And so the new unit, the 2020 truck, is again, it's a 450. Both of them 4-wheel drive, both of them duties. Was it was 160,800, but he gave it to us for 159,000, just round figures. So with some additional work that we're having done, which is the striping, we're leaving the striping on the used ambulance. We liked it. We saw no need to pay to stripe 2 ambulances, so we're just kind of transferring that design over to the new one. So round figures again, the cost to the 3 entities individually will be less than $100,000.
So when do you get to possession or delivery?
The estimate is 3 weeks. Because he's putting on new diamond plate on the back of the old ambulance. They're putting some chevrons, he called it, in the back windows of the new rig. Sure. And he's doing some light changing. Plus, we wanted, in the used rig, it has what's called an automatic kick out or whatever of plug, because you have to have it plugged in to heat the block. And if you jump in the ambulance and away you go and you forget to unplug it, kind of like when you do a gas pump thing, as soon as you start the engine, it automatically ejects the plug. So if you forget, it doesn't. So we're asking him to install that on the new ambulance, and he's going to make them like kind of quality, but he's covering the cost of that. We are installing the mount unit and the kit specific to the cot that CARE will use, so we'll have that lift mount in the other one. That's an additional $23,500. So all total, we're going to have, I've figured it out, each entity is going to have actually about $85,000 I like to say 100,000 because there's contingencies and we just don't know about yet for sure. Probably about 7,000 to do the striping. They're going to send emails back and forth between the graphics company and Judy Greason to see what it is, what it looks like, and any adjustments or whatever that she wants to make. So all in all, it was a hard. It took us way too long to get to this point. But that being said, I'm very cognizant of the fact that we came in much lower in cost than what we anticipated. We set aside 300,000.
So with rigs this size and knowing that we have problems in some of our cities getting around streets
Right.
because of blockages, is that a concern, or are we going to have one of the smaller, narrower ambulances that are like a Mercedes-Benz type?
Not like a Mercedes-Benz, but probably would be an an E450 that CARE is bringing down. Okay.
That was a concern I had when you talked about
Right.
dually vehicles, and
Right.
we
We
do
also
have
parked them in the hospital's
bay.
bay.
Good.
Mhm.
That was, we had to check, yes.
Good.
And the 550 will be parked. Most of the time, it'll be what we consider our winter vehicle.
Mhm.
The F450, in talking to Bob Libby, who runs CARE Ambulance, he said there's absolutely no reason not to have four-wheel drive in this environment. So
Correct.
all that being said, we could have bought an E450 from Foster, which I was advocating for 125,000, which would have met our needs along with the 550. But because, and I'm not finding fault, we had extended conversations about it because we're spending a lot of money. In the interim, he sold the rig to somebody else. And so we actually were down to one provider because North Central was just way too expensive for our taste. I'm not questioning the quality or anything. Bob Levy from CARE also said that 80% of what he has are Lifeline boxes. He's very familiar with them and he likes them.
Good, because I was going to ask what they thought about them.
And Kevin from Lifeline said, what we can do, he says, you drive this truck, put the used, he says, put about another 125,000 miles on it, trade it in on the new rig and take the box off and set it. Yeah,
So when they show up, where are they going to be stored?
They'll be stored wherever CARE Ambulance decides to. Right now, they're in negotiations with FEDA for the house out east of the spec building.
Right.
Attorneys, can I say anything regarding Midwest, or should I just not?
No.
You should not.
Okay. So
Can I say that I got a complaint and I shared it with Chauncey on Friday?
Yeah, and that's
that's all
fine.
I'm
All I
gonna
was
say.
going to say is that Bob and Kim have been in negotiations regarding that building. Okay, what comes of that negotiation, I have no idea. So at this point, potentially out east of the spec building or at the current location.
Okay.
And Pat or Chauncey, I need to talk to you after the meeting about another issue regarding them, so I'll call you.
Okay.
Okay.
Any reports from Dee?
Been working on my new part-time job, the food insecurity grant. So still plugging away on that, verifying receipts and all that. I attended the public health meeting, and so Dan's gonna go to 30 hours a week. ECI,
Should have already.
usual kinds of things going on there. Of course, a lot of their services are by Zoom presently. Workforce development, a staff person's been hired for our new area, and Wapello County auditor is going to do the fiscal agent. And then I had a few Pathfinder committee meetings.
Okay. We'll move on to public comments. We don't have anybody from the public in the room here with us. We do have Josh Larrabee on through Zoom. Do you have anything that you want to express to us, Josh?
No, was just had an opportunity to chime in this morning.
Great. Well, thank you for joining us. All right. I would accept a motion to allow claims and approve reports.
So moved.
Motion from Dimmitt, second from Sandquist. All those in favor say aye.
Aye.
All those opposed, same sign. Motion carries. Discuss and consider nuisance properties.
Follow up on your email to me, or text, excuse me. We have cited that property owner.
Okay.
The first step, citing, okay, sending of the letter and stuff. And so, and I do know that Bruce has been in contact with Pat regarding some other individuals, but this particular individual has been cited, so they will do follow-up.
Okay, so I'll follow up with the person that called me then and
Okay.
let them know that. I appreciate you doing that
Yeah.
because I know you know it a little bit better than what I do at this point in time. So that's why I reached out to you, Lee.
Pat, just a question about nuisance. So as we've talked about some of these right-of-way issues, would that be considered a nuisance, or is that a different area?
Right away is controlled by different areas of the code, so I would not think that it's a county nuisance issue. It's actually addressed in state code.
Okay. Thank you.
All right. Do we have any other business that needs to come before the board this morning? Hearing none, I would take a motion to adjourn.
So moved.
Second.
Moved by Dimmitt, second by Sandquist to adjourn. All those in favor say aye.
Aye.
All those opposed, same sign. Motion carries. Thank you, everybody, for joining us.